Hi Sarah, thank you so much for speaking to us on Medicine in a Nutshell. You are a GP trainee, is that correct?
That is, yeah.
And could you tell us, for folks who are not exactly sure, what is the actual remit of a GP, please?
So GPs are the front line of the NHS. GPs are actually responsible for 90% of consultations within the NHS. The GP is the first person you go to see if you've got any problem whatsoever. So that could be something as simple as a verruca or going on to something more complicated like abdominal pain. They're the person who you'll go to first.
And how does one actually get into GP training?
So to become a GP, you would first go to medical school for 5 years. You would then do your foundation years, which is the first 2 years after medical school. And it's at that point that you'd apply for your GP training. Now that lasts in 3 years at the moment, and after that you will be a fully qualified GP. So that's 10 years in total. So to get onto the GP training, you've got to do a few different things because we want the best people to become GPs. So firstly, you've got to fill in an application form. That's known as stage 1. You would then go and do an exam called stage 2, and that's just basically a multiple choice test. You go to the driving test centre to do it, so you've got people doing their hazard perception test sat next to you. It's not too hard, it's just what you're expected to know at the end of your foundation years. And then you also go on to do a OSCE style station. So what I mean by OSCE is that you've got encounters with a patient, encounters with a colleague, and people will observe you doing that and mark you. And it's just basically to see that you've got good communication skills, you can show empathy, you've got good professional skills as well, and it's just seeing how you deal with those different situations.
And what's the competition like to get into becoming a GP? So if you take 100 people who go through the application and OSCE and such like, how many on average would expect to be successful?
Well, we're actually absolutely desperate for GPs at the moment. You've probably seen in the news we've got a GP recruitment crisis going on. So it's pretty much, it depends where you're going to apply. So for London, you've got quite a high competition ratio. So you mentioned if you've got 100 people, the competition ratio in London is about 3 to 1. Elsewhere in the UK, you're pretty much guaranteed to get a job.
But there would be some sort of a bar that one has to overcome, meaning you have to have a level above which one has to perform to get in, obviously.
Yes, of course. So as I said, we want the best people to become GPs. So I mentioned the exams that you've got to do and also the clinical scenarios you've got to do. There is a certain level of pass mark that you have to do to get onto the GP training. That having said that, we do have lots of schemes available for people who may not meet that scheme. So we have extra years that you can do to help support you to bring you up to that level.
Great. And when one actually is successful with that and you get onto a GP training scheme, what does that actually involve? You said it involves 2 years, is that correct?
It's 3 years in
3
total.
years, sorry, yes.
Yep, so GP training's really good because when you get a job in a GP, you get allocated to what's called a scheme. So that could be something like Wakefield or Hull or Halifax and Huddersfield, for example, and you do all your training in that area. So you don't have to worry about moving around the nation, moving house every few years or so. And what you do is you do 18 months in a hospital post. So you would do 3 different jobs as part of that, and we're pretty good in that we let you get the jobs that you want, and you then do 18 months within a GP practice. And after that you do your 2 exams, and after that you're a fully qualified GP.
And when one does become a fully qualified GP, can one have areas of special interest?
Yeah, absolutely, and that's one of the things that actually attracted me about GP, because there is just so much you can do as a GP. So if you're interested in minor surgery, for example, you can do that. If you've got an interest in gynecology, you can specialise in that and do things like fitting coils, for example. You can do endless number of things. You can be a cruise ship doctor if you want, you can be a prison doctor. Basically whatever interests you, there's something out there for you as a GP.
Fantastic. So you're selling this GP thing well, and you are in the training. Are you enjoying the training yourself?
I'm really enjoying the training. One thing I've found with GP training sort of compared to my foundation years is that you get really well supported, and when you're actually in GP, you're actually only working clinically for 3.5 days a week, and you get 1.5 days of actually fully dedicated teaching and learning time, which I think it's just fantastic compared to, you know, running around on a ward. Getting that level of teaching is really good.
Fantastic. And any pearls of wisdom for people considering GP as opposed to any other specialty at all?
I would say GP is the best career, in my opinion, of course.
Of course you would.
Because there's just so much flexibility there. So you do your 3 years, and then, you know, if you want to work 2 days a week, you can work 2 days a week. If you want to work 7 days a week and go off around the world doing different things, you can do that, and you can work at weekends if you want. Equally, you don't have to work any weekends or nights at all if you don't want. So for me, it's the flexibility that I think sells it to you, and the fact that this is kind of what I feel like I went to med school for. So the fact that you get that continuity, you get to see the patients sort of growing up, having families and things. I really enjoy that as a doctor, and I think that's one of the main things that encouraged me to do it.
Well, Sarah, that was an excellent insight, and might I say a fantastic advertisement for primary care, you know, becoming a general practitioner, GP if you would. Thank you so much for speaking to us on Medicine in a Nutshell. And hopefully this will attract more young people and not so young people to come in to become GPs in the future. Thank you very much.
Thank you.